Let's get more on the medical situation in Gaza, and for that I'm joined by Dr. Omar Abdel-Mannan, a British-Egyptian pediatric neurologist and the co-founder of Gaza Medic Voices. He worked and taught in the enclave over the past 10 years and joins us from London. Doctor, thank you so much for your time on TRT World. When we listen to what our correspondent is telling us about the famine that is encroaching on Gaza, for some this is what they're experiencing right now. Then we have the breakdown of the healthcare system. In real terms, what does this mean for Gazans? Because it's not down the line. This is over the next few days. They are going to be deeply impacted.
Thank you so much. And thank you to Nazar for his courageous reporting from inside the Gazan Strip. What I can say in real world terms, this current situation means that every 10 minutes, one child is dying or loses his life. Every day, 10 children are losing one or two of their limbs. They are becoming amputees, which has connotations for the rest of their life. What it also means is 90% of the population is unable to eat one meal a day, which means that these children, especially the ones under the age of 2, have lasting, permanent damage in terms of their long-term health sequelae. These children will suffer from neurological problems, from problems with a heart disease in the future, with a risk of cancer. This is what the real-world terms are for this Israeli bombardment and continual targeting and destruction of a healthcare system. And the irony is, just a few miles up the road is the most advanced healthcare system in the world. And these patients, these people who are starving, these people who are unwell, they cannot access even a single doctor or paramedic. Our colleagues on the ground in Gaza, working with WHO, sent me a message 3 days ago. They were working at al-Aqsa Hospital, and they said that al-Aqsa is collapsing in a similar way to how al-Shifa did. They said the Israeli Defense Occupation Force is clearing middle Gaza, and they are bombing around the hospital consistently. In the Aqsa emergency, there is only one doctor, and we had 500 admissions overnight, 500 patients. The injuries are horrific. The burns are horrific to large numbers of children. And this colleague of mine said that he and another surgeon were the only 2 operating surgeons in that whole hospital, despite patients coming in with extremely difficult injuries that needed urgent operations. Many people died on the floor in the Aqsa emergency. There are 40,000 people in the next door refugee camp in the space of 60,000 square meters. That's just over 1 person per square meter, and 1 toilet for every 700 people. So you can see these conditions are ripe for diseases, infectious diseases, cholera, even polio.
Yeah, Doctor, this is also the concern, obviously, for people like you and your other healthcare workers in Gaza. If an Israeli strike doesn't kill people, it's going to be the diseases coming from this, like cholera that you've said. There is a lack of sanitation, clean water. This, of course, also for children, they aren't being vaccinated because vaccines aren't allowed in. The people suffering the most here are the most vulnerable.
Absolutely. This is the consequence of destroying a healthcare system. When we were living in the UK and we saw COVID coming and we saw the Italian healthcare system stretched to the point of near collapse, and we worried about our own healthcare system, and we saw that we struggled and many of our patients died at the door because of the lack of oxygen, the lack of help. What we knew is that afterwards there would be a return to normality because we had our hospitals still standing and our staff was still there. These doctors in Gaza do not have anywhere to go back to treat patients. These patients do not have anywhere to go back to. This mission, this escalation by the Israeli occupation forces is clearly an attempt to destroy and level a whole strip of land, to move and forcibly displace 2.3 million Palestinians out of their homes. There is no question about this clear agenda that the Israeli states themselves have been making these claims of they should go to Egypt, they can go to the Congo, they can move out. But Palestinians will resist this. And the international community should resist this. And if our leaders have any humanity left, and I suspect they don't, they should be standing up and saying, hang on, this is not acceptable in 2023. We cannot just watch mass genocide live on TV, mass extermination of people by disease and by bombs. This should not be happening. Where is the outcry? What is the magic number that Mr. Sunak, Mr. Biden, Mr. Netanyahu need to see of children without limbs, of children without families, of doctors dying before they put an end to this?
And that death toll already surpassing wars that are ongoing, like the war in Ukraine, and past wars like the Vietnam War. Doctor, I'd just like to find out from you, as a medical professional, as someone who has worked in Gaza, what it would be like right now for those doctors, those nurses, any medical professionals trying to cope with what they are seeing on a personal and professional level, because of course they're not there just working. They are Palestinians living through what has been described as a genocide. I cannot even imagine the emotional toll that that takes on a person.
I can't imagine it either, because I've never, fortunately for me, I've never been in that situation, and I pray to God I never am. But the reality is, these doctors, these healthcare workers are heroes, because what they are coping with, the volume of patients they are looking after, the decisions they have to make day to day, the level of pain and emotional suffering they suffer when they see their own family members bombed or killed, or their own colleagues coming in bombed and killed, is horrific. And they are having to worry about the safety of their own family. I know doctors who have been bringing their family to the hospital because the family, their wives and spouses, or their spouses and children have said, we either live together or die together. So this is unacceptable. Healthcare is a sanctuary for people. It is a place that should be protected. It is protected under the international law, but we have a state that doesn't care about international law, that is such a pariah state that it is able to do what it wants because it has watched this impotence of the Western world continue to allow it to operate at large with the audacity and arrogance of just wiping out people like they are numbers and telling us that, yes, we will bomb mosques, yes, we will bomb hospitals as long as there are tunnels underneath. So these doctors are working in the most horrific conditions. They are struggling day in, day out, emotionally. And I know this because I speak to them. And many have had to flee. The Aqsa Hospital has broken down since I read that message to you. There is no healthcare being provided in there. There are 5 doctors covering a whole hospital, thousands of patients. That is just unmanageable. At some point, these are human beings who will break down. They have had no help from the outside world. The outside world has sat silently. Silent majority of people have just watched this unfold behind their TV screens, when people can actually use their power to hold protests, to hold sit-ins, to start applying pressure, to call for sanctions and boycott of this terrorist state.
Really appreciate you talking to us. Thank you so much.